Hello everyone, my name is Laura Gomez and today I'm gonna be talking about CVAs. CVA is what we consider stroke that we commonly call stroke, and there is two different types of CVA: ischemic and hemorrhagic. An ischemic stroke is caused by a blockage in the vessels, and a hemorrhagic stroke is caused by a rupture of a vessel. So the two differences is hemorrhagic is a bleeding, ischemic blockage. Ischemic strokes are caused by obstruction of the blood flow to the brain, causing lack of oxygen due to a wandering clot in the arteries called an embolus, or a clot formation called a thrombus. So within the ischemic stroke, we have two different classifications as well. And a hemorrhagic stroke is basically a bleeding, rupture of a vessel, a bleeding in the brain that it affects the surrounding tissues and applies pressure on the brain, and it causes lack of oxygen and all of the other symptoms of a stroke. Two symptoms that are very common in strokes are what we classify as a hemiplegia and hemiparesis, and students sometimes struggle with differentiating the difference between the two due to the similarities in the wording. So hemiplegia, hemi means one side of the body. For hemiplegia, P for paralysis, plegia means paralysis. And for hemiparesis, paresis is weakness, overall weakness. So the way that I train myself to remember it is hemiplegia, P for paralysis, hemiparesis, S for weakness. When we talk about in what part of the MBCOT process and the domains we find CVA, it will mean all of them. So a CVA, the stroke, is something that we see in the continuation of care from the beginning until the end, and it is found and shown in all of the domains. So all of our domains can be involved in the CVA. Like a CVA can be presented, and the question in the MBCOT exam can be presented in a different point of view depending on the domain that question belongs to. So for example, there can be a question during the evaluation process of a stroke patient and what assessments to use. There can also be a question about the analysis and interpretation of those assessments and planning and creating a plan of care for that patient with that stroke. And that's when you take into consideration the setting, the age of the patient, the location of the CVA, and all of the symptoms that the patient is presenting. Then in domain 3, we have select and manage interventions. So in this stage, we are targeting all the deficits and all the weaknesses that the patient is presenting with. And then for domain 4, the competency and practice management, it will basically mean informing yourself using evidence-based practice and critical thinking appropriate for your patient, and also using always using benefits and doing the best for your patient, informing yourself, and working in a collaborative way with the other team members. Then we have the different types of stroke. So why is stroke difficult to understand for some students? A stroke has different strokes can happen in different locations of the brain. As we see in the picture, we have the middle cerebral artery strokes. So these types of strokes are shown here in the green area. So patients that suffer from this type of stroke will present with contralateral hemiplegia, aphasia, homonymous hemianopsia, dysarthria, and overall weakness. So patients with anterior cerebral artery stroke will be in the purple area of the brain that we have right here in the picture. They will show hemiparesis in the contralateral lower extremities, so a lot of weakness in the lower extremities. Then we have the posterior cerebral artery stroke. These patients will present with ataxia, dizziness, diplopia, which will be double vision, hemiparesis, hemianopsia, dysarthria. We're gonna see also strokes located in the basilar artery right here. Patients with this type of stroke will have difficulties breathing. They will also present with sensory issues, balance issues, tremors, vomiting. We are also gonna see strokes presented in the cerebral, in the cerebral area, and these patients will have anterior cerebral, so it will be right here and right here, so anterior, middle, and posterior cerebellar. So these patients are gonna have a lot of headaches, sensory issues, vomiting, fevers, issues with balance, and dizziness. So an example of a clinical application is the following scenario. So the patient is a 68-year-old male admitted to inpatient rehab post left middle cerebral artery ischemic CVA. The patient presents with hemiparesis, decreased coordination, impaired sensation, and mild neglect. The patient also presents with mild expressive aphasia and difficulties following different commands. So from reading these, we can assume right away, since the stroke was in the left side of the brain, we assume that all of these issues are affecting the right side of the brain. So the right side of the body. So we have right hemiparesis, decreased right upper extremity coordination, impaired sensation in the right side of the body, and right mild neglect. So we can assume from this and that the patient is having all of these issues in the right side of the body due to the CVA on the left side. From there on, what would you test on? So you will test on range of motion in that right side of the body, comparing it to the left, manual muscle testing, and checking their strength, because they are suffering from hemiparesis, so that's weakness. So they are able to move the arm, but that arm is gonna be very weak, very weak. We can also assume that we have to check for sensation, balance, cognition, and perception, because he's having difficulties following different commands. Also, we have to take into consideration if the patient is a right hand dominance or left-handed. This will play a huge role in how we train this patient on how to dress themselves, using one-handed technique or using compensation techniques, and involving the right extremity into completing all those ADLs. This is a table which is very useful visual organization tool. It has like the locations of the stroke, the common symptoms that you can find on the patients, and a mnemonic kind of like idea of how to recall what those symptoms are and what they mean. So for example, we have the internal carotid artery CVA, and this we have the word C for hemianopsia, so we know that there's some affected vision there. We have speak for aphasia, and we have move for hemiparesis, so a lot of weakness, which means decreased movement on that area. So this chart is very useful to recall what each symptom means and what symptom is presented depending on the CVA location. And then last but not least, we have some mnemonic recall strategies. This one is protect. So this is something that you could use to recall all of the safety considerations that you need to take into that you need to be aware of when you're treating a hemiplegic upper extremity. So P for positioning. So when we're doing the transfer, when we're doing the dressing, position that right upper extremity or left upper extremity in a correct way so it doesn't get subluxated. R, reduce the risk of subluxation. Like I said, this is the main important thing, and it is very common for patients recovering from a stroke to suffer subluxation of the shoulders. O for observe and motor and sensory status. This is very important because these patients are gonna have lack of some motor and sensory and sensory input into their affected extremity. We have T for train functional movement, so we're gonna reteach that extremity to start moving again. E for encourage safe affected site participation. So instead of neglecting the affected site, we're gonna use that site to help complete some of the ADLs and involve it into completing all the activities, so we can retrain and increase the participation of that extremity that is affected, so it doesn't get neglected and we get the patient right back to where they started. Then we have a C for compensate, so providing them with the right adaptive equipments and grading and environmental modifications to facilitate the completion of those ADLs. And T, teach the patient, caregivers, and everyone that will be involved in the patient's care how to treat that affected site and all those symptoms that the patient is gonna have. And then we have B fast. This is the most famous one for stroke, and this is to identify a stroke. So patients that are gonna be suffering from a stroke are gonna present with B, loss of balance, so the balance is gonna be affected. E, changes in their eyesight, so they're gonna see double or have issues not seeing correctly. F for facial drop, so one side of the face is gonna be dropping lower than the other. A for arm weakness, so when you ask them to extend their arms, one is gonna be higher than the other. S for speech difficulty, so their speech is gonna be slurred. And T, time to call 911. All of these are very useful to recall when treating a patient with a stroke or at risk of a stroke. And that will be all. Thank you so much. I hope this helps.